Having the opportunity to work with my mentors and then work with some of my other peers has been super beneficial. I think being able to be hands-on and have my mentors come into the clinic and like work with me on like a really tough case that I'm having problems with has been super beneficial. I think where I was before starting the residency, I was like fresh out of PT school and I graduated during COVID, so I didn't really have a lot of those hands-on skills because we were missing like about almost 2 years worth of curriculum. So I think the residency has really helped in that regard of like getting more hands-on, getting more tips and tricks of the trade and things of that nature that have really helped my clinical practice for sure. My journey has been a lot less trial and error. I think a lot of my classmates have either like switched jobs multiple times since PT school, and they have also like really been struggling with some of their cases, which is like hard to deal with. But I think for me, like even if I have a case that I'm struggling with, I have my other peers that are in the residency, and then as well as some of my mentors who can like kind of help me through that stuff versus my classmates who may not have that same like network and opportunity to be able to ask somebody for help in the same way and really be hands-on with somebody. The networking opportunities that we have had have really helped me to kind of like help bridge the gap between PT and physician, which has made it a lot more cohesive relationship, so that way we can help our patients even more. And I will like talk back and forth with them, which kind of helps get the patient back on the right track that we want them on. From a leadership standpoint, I think just like going out into the community and like helping out with these different athletes and things of that nature, and then they kind of develop a connection with me, and they feel that, you know, they feel more comfortable and they feel more willing to do things from like an exercise standpoint, a rehab standpoint, than probably what they were before. In regards to what I wanted to do was more of like, you know, high school, maybe college, and then now like being in the residency, it's like, oh, like I think I can push myself even a little bit further. You know, maybe I can get into professional sports and things of that nature. I think just continuing to push myself, and the residency has definitely showed me that, okay, you know, I've been able to check off this box, and it's like I made it through and it wasn't that bad. It's like, you know, maybe I can push myself even a little bit further to kind of get as high of a like clinical experience, clinical learning, like all that stuff, like pushing myself to as high as I can go. I think it really shows that TJC gives us a really good opportunity to learn and a good opportunity for us to become the best clinicians that we can be. I have meetings with you and then meetings with my mentors and all that stuff, so I get a lot of like one-on-one attention and like almost like PT school, but you have like 20 other classmates that also need one-on-one attention. I feel like I'm able to like spend a lot of time with my mentors and people that are like higher up in the organization that really feed into me a lot and help me grow my clinical experience and my clinical practice. TJC has really helped me grow as a clinician. Like over the past year and a half, I feel like it's a night and day difference.